your name?
It's 8:30 a.m. and the phones are already ringing off the hook.
Appointment signed, Vicky speaking. How can I help?
On average, receptionists at Elmbank Medical Practice answer more than 1,000 calls a day.
Good afternoon, Elmbank Appointment Line. Ruben speaking. How can I help?
On a daily basis, we see in excess of 100 unscheduled care contacts, sometimes reaching 130, 150, and that workload is managed by 2 GPs. So that equates to sort of 50 to 70 patient contacts per GP, which is 2 or 3 times above what the BMA recommends as a safe limit. We're practicing medicine, but we're not practicing it in a way that we feel is safe. You'll feel that squeezing around your arm.
Elmbank's registration list has hit maximum capacity. They have around 11,000 patients on the books, so getting an appointment isn't always easy, and not everyone accepts that.
We've had, if you don't give me my medication and I die, it's your fault and you'll need to live with that. Give me an appointment with my doctor, you're stopping me, you're a bitch. We've had staff followed to the bus stops by patients. I've called the police twice since I've been here on patients that have been verbally and physically aggressive.
I mean, that's just soul destroying.
It's absolutely soul destroying because nobody comes into healthcare not wanting to do the best job, not wanting to help people. But people are horrible. I've got young staff through there who are being told, I hope you and your whole team commit suicide. And we're genuinely just trying to help. And it is horrible. It's absolutely horrible. We're doing the best we can.
Hello there, this is Dr. Guru from Elmbank Practice.
Since 2012, the number of people trying to access GP services in Scotland has risen by 300,000.
OK, Rebecca, I'll let you come and take a seat for me.
But at the same time, there's been a 9% decrease in practices.
So, how can I help you today, Rebecca?
I think I might have...
I think the biggest challenge we face as a profession at the moment is the issue around demand versus capacity. Alongside that, we have an ageing population. So not only are we having to look after more patients, but the patients that we are seeing are more complex, more frail, and have more illnesses that we have to manage. That takes time and it takes more GPs. And are you managing to keep down fluids?
Squeezing in multiple phone consultations a day has made it easier for doctors like Dr. Barner to prioritise their sickest patients. But the British Medical Association recommends GPs spend an average of 15 minutes with each person, regardless of their condition. Dr. Barner says that's not possible.
It's frustrating and it's heartbreaking. We come into this profession wanting to look after our patients thoroughly, most importantly, safely and properly, and we're just not able to do that with the demand that we're facing.
Dr. Barner says until the workload eases, every practice in Scotland is going to struggle with the recruitment and retention of medical staff.
We have a couple of vacancies advertised at the moment, and we've had, we've had some interest, but not as much as we would hope, and that's a significant change over the last sort of 15 to 20 years.
One of the big challenges for the office staff is when people come in for an interview and we say, it's really busy, the phones will ring all the time, the phones will not stop, and people are going to be horrible to you. You think, I'm having to tell them this in an interview when I'm trying to persuade them to come and work in the practice, but I have to tell them what the reality is like.